followed by a detailed assessment of limitations. The GRADE approach assesses the confidence in estimates of effect, i.e., the quality of a body of evidence for an outcome following a stepwise and transparent process. GRADE classifies the confidence in an estimate of effect into 4 categories from very low, moderate to high. The quality of a body of the available best evidence is assessed, beginning with an evaluation of the underlying study design, randomized trials versus observational studies. This is followed by a detailed assessment of limitations in the design and execution of the study's risk of bias, imprecision, inconsistency, indirectness, publication bias, magnitude of effect, dose-effect relations, and an assessment of the effect of plausible residual opposing, confounding, and bias. The overall quality of evidence is determined by the lowest quality of evidence for each of the critical outcomes. When outcomes point in the same direction, all critical outcomes suggesting benefit, then the overall quality of evidence re-ECTS the quality of the better evidence, e.g., 2 critical outcomes showing convincing benefit are of low quality and a third of very low quality. The overall quality is not reduced from low to very low. This approach is used by over 70 international organizations, including the World Health Organization, WHO, the National Institute of Health and Clinical Excellence in the UK, NICE, and professional societies such as the American College of Physicians. Guidelines are systematically developed statements based on the best available evidence that should assist providers and recipients of healthcare and other stakeholders to make informed decisions. Recommendations and guidelines may relate to clinical interventions, public health activities, or government policies. The key elements of each synthesis include the scope of the guidelines, the interventions and practices considered, the major recommendations and the strength of the evidence and recommendations, and the underlying values and preferences. Over the past few years, several groups have suggested standards for the preparation of clinical practice guidelines. A high-quality clinical practice guideline should consider the following steps, which include a systematic review of the literature. 1. Define explicit criteria to search for evidence. 2. Define explicit eligibility criteria for the identified evidence. 3. Conduct or use comprehensive searches for evidence. 4. Perform a standard consideration of study quality. 5. Summarize the evidence. 6. Acknowledge values and preferences underlying the group's recommendations. 7. Grade the strength of recommendations. This is our course about evidence-based medicine. Thank you for your listening.